Hi everyone, welcome to the Menzies School of Health Research podcast series for the NT Youth Health Summit initiative called Youth Choices, Youth Voices, where we aim to hear from young people and specialists about youth health priorities in the NT. A special shout out to our sponsors for this event, including Hot North, CDU, the Northern Territory Government, NTPHN, Bridging the Gap, Ironbark Corporation and Charter Air. I'm Lateesha Jeffrey, and today on episode 8, I'll be having a chat with research fellow Dr Renae Kirkham. Dr Renae is co-leading a program of work to improve care for young people with type 2 diabetes. Dr Kirkham is a social scientist with an interest in health interventions. Welcome to the podcast, Dr Kirkham. Thank you so much for joining me today. We got through some of our little IT issues, but we're here, and it's absolutely amazing to have you. How are you going?
Yeah, great. Thank you. Thanks for having me.
No worries at all. I'm looking forward to this. So we'll get straight into it. Can you tell us a little about yourself, like where you've come from and how you came to, be doing what you're doing today?
Yeah, sure. So I grew up in Port Augusta, a little town in South Australia, also known as the Crossroads of Australia. And there are at least 32 different Aboriginal language groups that meet in Port Augusta. And so I learned from a really young age that there are many disparities between Aboriginal and non-Aboriginal people. Learning from our community and the different things that I saw and experienced. And this definitely fueled a fire in my belly for wanting to work to improve health outcomes for Aboriginal and Torres Strait Islander people. And so I ended up doing a PhD in public health, which focused on the roles of Aboriginal maternal and infant care workers. And how they deliver safe antenatal and birth care to Aboriginal women in the community of Port Augusta. And so this then led me on a path north, straight up the Stuart Highway to Darwin, also being the place where my partner grew up. And we've since settled over the last 10 years, and our roots have grown really deep in the community up here. And I really see working in public health as a really important opportunity to improving health outcomes for different people across population groups.
Well, thank you. And were you always interested in diabetes, or were there a few other areas of health that you have dabbled in?
Sure. So to be honest, diabetes is not really my specialty area. Rather, it's about my specialty area is in designing models of care that better meet the needs of different people and different population groups, particularly Aboriginal and Torres Strait Islander people. And as I said, my PhD really explored a model of care to support more appropriate ways of delivering antenatal care to Aboriginal women and their families. And I also work in this space across the NT and far north Queensland, assisting with the development of models of care that better meet the needs of Aboriginal and Torres Strait Islander women who have diabetes in pregnancy. So that's sort of how I got to work in the diabetes space. And I've also got a really strong interest in the health and wellbeing of young people. I've worked in different projects and different areas of youth health over the years. And this is where my development in the youth type 2 diabetes space really came from. And also, I was involved in the Youth Health Summit a couple of years ago, getting that off the ground.
Yeah.
So really, I think it's really important for us to give young people a voice, particularly when we're developing new models of care or different ways to support young people in managing their own or to health and wellbeing, but also to promote better health and wellbeing outcomes for the younger population.
Yeah, so you already touched on, so you obviously co-lead a few projects at Menzies and again, which focus on young people and diabetes, but can you, maybe just share with us a bit of information about diabetes and how it affects young people?
Yeah, sure. So as I said, I'm not a diabetes expert. I work with lots of people who are, including lots of specialists who are endocrinologists. But what I can tell you is that there are two types of diabetes. There's type 1 diabetes and type 2 diabetes, and typically young people experience type 1 diabetes. However, in recent years, we have been recording that more and more young people are being diagnosed with type 2 diabetes, particularly young Aboriginal and Torres Strait Islander people under the age of 25. So type 2 diabetes is diagnosed when the body can't regulate the amount of glucose or sugar in the blood, and our pancreas produces a hormone called insulin, whose job it is to regulate the amount of sugar in the blood. And so it can remove sugar and transport it to the different cells of the body that need it for energy. But when the body isn't producing enough insulin, or the insulin isn't working properly, type 2 diabetes is diagnosed. And we know that if diabetes isn't well managed, some of the negative complications can include chronic kidney disease or heart issues, foot ulcers. Some people have issues with their vision. The list goes on. But we also know that there are lots of interventions that can help to help people to manage their diabetes well, so that they don't experience these negative complications. So some of these include eating healthily, engaging in physical activity and sports, and also taking certain medications that can all help to keep the level of sugar in the blood at a healthy level. And so then people can live really healthy lives without experiencing these negative complications of diabetes. And in our project, we're really looking to find ways that better support young people to manage their diabetes, to support them to live the best life that they possibly can.
That sounds really good. And part of your research is about breaking down barriers to accessing healthcare for young people with diabetes. And tell us about this and why that's important as well.
So we know that having access to appropriate healthcare for anyone is really important to helping them better manage whatever their health or wellbeing issue is. And ultimately, good access to care, appropriate access to care, can improve health outcomes. And so in our context, this might mean making the clinic more culturally safe, culturally appropriate, and delivering the information about different health conditions or different support systems or networks in a really appropriate and clear way. So getting the language right. So up until now, diabetes care has been largely designed for adults because typically we only saw it in adults. So this has created a gap in that we need to now create the right support systems and the right access to care that's appropriate to the younger generation who are experiencing diabetes. And so one of the barriers that we've recently seen is that because it's a new emerging condition, lots of people don't know much about type 2 diabetes in young people. This includes health professionals, communities, families, young people who are being diagnosed themselves, and it makes providing appropriate care really challenging. And so far in our research, we have learnt that many people feel shame about their diabetes, about being diagnosed with diabetes. Many young people lack access to support networks that will help them to manage their diabetes. And they often don't have access to that clear information in the right language. They don't like going to the clinic, or they might have other priorities in their lives that don't really create the space for managing their diabetes in ways that will best help them. And so really our project is about designing those support systems that will help our young people who have type 2 diabetes across Northern Australia. So we're talking about the Kimberley region, across the NT, and also far north Queensland, to help them to better manage their diabetes. It largely draws on one of the priorities from the 2019 Youth Health Summit, which was about meeting young people at their point of need. So we're trying to encourage healthcare providers and researchers to think differently about how we can best support our young people.
Yeah, and as someone that conducts research, how important is it for you to hear from those young people? So you've already spoken about how you're trying to implement, I guess what was brought up in the last summit, and so again, how important is it to hear from young people and be guided by our young people as well?
Well, I guess conducting research that's primarily concerned with the health and wellbeing of young people means that it's absolutely fundamental that we hear from them and are guided by the young people themselves, because really it's about working together to find solutions rather than taking a traditional top-down approach where the researchers and service providers automatically assume that position of being expert. But we all know that young people often have the solutions. We just have to work together to implement them. And
Yes.
I guess also recently have become a mum, and something that I've really learnt from this journey is that young people, even babies, they know what they want and they know what they need. It's just that we need to learn to listen to them better. And so we might not speak the same language, but we need to learn to find that common ground so that we can better meet the needs of those who are more vulnerable than us.
Yes, and I completely understand as a mother myself as well. So, and how do you believe we can better engage young people in these discussions about health, or what have been some of your strategies to liaise with our young people as well?
Yeah, so to be honest, I find this space, it can be quite challenging. It sounds like it is very straightforward, but of course it's not. And I think largely it's because we so often come to a space with our own preconceived ideas around how something should happen or not happen. But in our project and in the work that a lot of the work I'm involved in, I'm really keen to create a space that young people can come to and feel not feel judged, and feel that they can openly communicate and make suggestions as the experts, and that we then act as facilitators to try and implement some of the changes that would best meet their needs. Of course, within the some of the structures and things that we already have, we can't promise the world, but I think it's really important to acknowledge that young people often do have the solutions. And so in terms of our project, we've been really keen to engage with young people with type 2 diabetes, but it's been really challenging, and often we've fallen flat in some of our attempts. And I think on reflection, some of this might be to do with the stigma and shame that's often associated with having type 2 diabetes, which I'm sure makes discussing this topic quite challenging and maybe confronting, and also makes it probably less likely for young people to come forward and want to talk to us about having type 2. And so I think when you, it's challenging when you create a forum or a platform where you're almost singling people out to come forward or inviting them because of the condition. There are some really important considerations that you need to think about, because it can be quite a sensitive space. And so across the board, I think that it's really important to create opportunities and forums for young people to be able to come forward and provide feedback and suggestions to discuss health and wellbeing issues and different requests or commands, as we might put it. And I think we need to be really consistent with our engagement attempts. So make sure that we're showing up constantly, and that if young people aren't coming when they say they would, just to understand that there might be something else going on, but we, to be a consistent face and make that commitment to let them know as well that we really are committed to improving their health and wellbeing.
Yeah. And that's really, and it's also, instilling, it's all that, pre-work you've got to do. So it's instilling the confidence into our youth to actually be able to speak up. And it sounds really amazing what you're doing, and consistency is definitely going to be key in moving that forward as well. But thank you so much, Dr. Renae Kirkham, for joining the podcast today. Did you have anything you'd like to add before we go, or a message you'd like to share with young people?
No, I just think thanks for the opportunity to be on the program. And I just encourage all young people to feel confident and to know that as researchers and as a researcher and healthcare providers, we're all really, really interested and keen on your feedback and suggestions, because without you, I'm sure that all of the systems and models of care that we attempt to design don't work. So please speak up and give us the feedback we need.
Thank you, and that's a good message indeed. And that was the 8th episode of our Menzies School of Health Research podcast series for the NT Youth Health Summit initiative called Youth Choices, Youth Voices. Thank you. If you can, please support the Youth Health Summit initiative by getting in touch via the Menzies School of Health Research website. Thank you for listening. Please join us again next time.